ensure that the patient has a private area to answer questions and to conduct the vital assessment. I would then ask the patient what their name is.
My name is Andy Villahuerta.
I would also assess the patient's mood by asking how the patient is feeling today.
I'm feeling good today.
I would also assess for pain by asking if the patient is currently under any pain.
No current pain.
I would observe the posture and position, and I would note hygiene, grooming, and dress. I would then continue the assessment by asking the patient if it's okay for me to go ahead and assess their head.
Yes, it's okay.
So I would check for symmetry. I would check hair distribution to make sure that the hair is even throughout, looking for signs of alopecia or anything else. I would also assess the face and the ears. I would also look at the skin on the face. If it's okay with you, you could remove your mask. I'm going to look for ear shape. And I'm going to look at the mucous membranes. If you could look up for me. Mucous membranes appear healthy and moist. Okay. And I'll be testing for hearing. If you could cover your right ear with your hand. Okay, and then I'm going to whisper some letters to you. E, T, K.
E-T-K.
Now the left ear. A-J-Z.
A-J-Z.
Okay. In order to move forward with the respiratory section of the vital assessment, I would ask the patient to take in deep breaths while holding the stethoscope up to the chest. Okay, if you could take a deep breath for me. Okay, the patient's lung appears healthy, no crackling or wheezing when the patient breathes in and out. I would also assess the patient's breathing from the back. Breathe in. Again, the patient's breathing sounds normal, no wheezing or crackling in the lungs. And finally, I would also check the lungs breathing on the sides. If you could lift your arm up for me, all the way up. There you go. So breathe in. Thank you. And again, the patient has normal breathing. Next, I will be checking the patient's heart sounds. So the first cardiac landmark that I'll be checking is the aortic landmark right here. Followed by pulmonic area. Followed by Earth's point. Followed by the tricuspid area. finally followed by the mitral area. The heart has normal rhythm and is not bradypneic or tachypneic. Next, I will be checking for the radial pulse. Patient also has strong pedalis pulse. I will now be assessing for capillary refill. Capillary refill is less than 2 seconds on the toe. Capillary refill is less than 2 seconds on upper extremities. I will now assess the patient for immediate memory and recent memory as well. What did you do today, Andy?
Today I went to work.
At what time did you go into work?
I went to work at 10 a.m.
Okay. I will now observe eye alignment. If you could look at me. I'm going to ask you to follow this pen light right here. Patient has healthy eye alignment while keeping my pen at least 12 inches away from his face. Next, I will assess for Perla. Okay, so I'm going to ask you to just look forward now. Patient shows healthy dilation. Next, I would observe my patient's spine from lateral and posterior views. If I could have you face your left. And now if I could have you turn your back towards me. And then towards me, please. Okay. And if you could close your eyes for a second. Okay, if you could open your eyes and walk towards me. For the abdomen, I would check contours and see if he had any scars or lesions. I would then osculate for bowel sounds, going over the right upper quadrant, the lower right quadrant, the left upper quadrant, and the lower left quadrant. Also palpate the patient's abdomen to see if there was any pain or any tenderness or soreness. For the integumentary system, I would assess the skin. Check for any redness or discolorations, any lesions, any scars. I would pinch the skin over his clavicle to check for skin turgor. I would also inspect his nails for any clubbing. And I would check for any reddening of the skin. Using a thermometer, I would assess for temperature. If you want to pretend I'm putting in a thermometer, I would put it sublingual. Assess for temperature. I would also note the body hair at this point and see how it's distributed. And I would also palpate for temperature and moisture. I will now take my patient's blood pressure. I've already gone ahead and placed the blood pressure cuff on him and put my measuring tool up here. I'm gonna place my stethoscope in the antecubital area, near there. Patient has a blood pressure of 115/80.